Welcome back, Zoe. So this is your third session now, isn't it? So in the first session we did a few months back, we focused on adding some deep structure in, because it's this area down here, isn't it, that's bothering you in the lower face. So we would add some deep structure in, particularly in the lateral part of the face, following our deep to superficial, lateral to medial, superior to inferior approach. So we did the mid-face, a little bit along the jaw, deep pyriform space and the chin. And then at the second time, which was around a month or two later, we then focused superficially in the lateral part of the face using a biostimulatory treatment. So in this case, we used a Lance, and all of that was, if you turn your head to the left there, was along the lateral zygoma, preauricular, and down towards the mandibular angle here. Turn your head this way. Very good. And we can see that we've got lovely definition down in the lower part of the face. At the moment, we can't see anything dramatic with the Lance. It's only been 2 or 3 months or so, but even when I was taking your makeup off before, Zoe, I could just feel that the skin wasn't creasing in the same way that it was beforehand. Have you noticed any changes in your skin?
Yeah, yeah.
Okay.
Yeah.
Thank you. And so today we are doing the third and final session where we're doing the finishing touches. So at the moment, or so far rather, we've focused on everywhere to add that support and structure back into the skin and restore that deeper volume loss. But today we're going to put the icing on the cake and focus directly in the nasolabial folds, the lip and perioral area, and a little bit in the lower face, labiomental crease and labiomandibular fold. So with our treatment plan today, like I said, we're going to be focusing on the medial part of the face. And this is normally the last place that we want to treat. We want to add that deeper support and structure in the deeper layers, the lateral part of the face, and rather than going superficially and medially. So we've already treated the deep pyriform space here. So this deep pyriform fossa. What we're going to do now is with a cannula treat in layer 2, again in the pyriform fossa, but coming down inferiorly towards the caudal pole of the nasolabial fold. We're also going to be treating in the upper lip some of these perioral lines. Now, perioral lines are notoriously tricky to treat because they are multifactorial. You have the dermal creasing in the skin and the breakdown of collagen in the deep layers of both the reticular and the papillary dermis. You also have loss of subcutaneous fat between the skin and the muscle. And of course, you have the muscle contractions. So what we can do with filler is somewhat limited, but by coming in with a cannula and subcising the dermis away from the muscle layer, we can create some space between the muscle contraction and the creasing of the dermis. And by doing so, we can reduce that constant mechanical stress on the dermis. At the same time, we can fan small amounts of very soft and minimally hygroscopic product to try and add some of that support back in, whilst being really conscious that this area is prone to swelling. And it's also a highly mobile area. And if we use a filler that's too firm, it's going to affect that. The next thing we're going to do as we come inferiorly is treat the lips themselves. Now, already Zoe has got a really, really nice shape to her lip. We've got a really well-defined Cupid's bow up here, and we just want to add a small amount, or rather we want to restore a little bit of the volume that has been lost over the last couple of years or so. So for that, we're going to use actually a slightly stiffer product, but less of it to add that support back in. In the lower face here, we're going to be doing a little bit of a 2-in-1 treatment where we want to bridge the gap between what is actually now quite subtle jowling and lower face heaviness here, and bridge that gap between here and the chin. We need to be mindful of a couple of things here. One is that we don't want to add too much width to the chin. Typically in female patients, most of the width of the chin should lie within the width of the nose. If we bring too much of the width out, we can masculinize somebody's lower face. The other thing we need to be careful of is not adding too much volume posteriorly here, because if we add volume into the jowl fat pad itself, then we can make this area look heavier than it is and cause the opposite of what we're trying to treat. So I'll be coming in with an entry point anterior to this fold around here and treating down here. It's a little bit of a fiddly area to reach, but it is possible. From the same entry point, I'll then come along and treat the labiomental crease. If you turn your to the left, this is nice because it adds a bolster of support between the chin and the lower lip and has the effect of providing some inferior rotation or downward projection off the chin, as well as helping soften this crease and making the whole lower face area look a little bit more rejuvenated.
Sorry to interrupt this video. Hi, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I'm the one doing the injection that you're watching right now. I just want to take a moment to talk about our injectables diploma. So Harley Academy is a higher education college for aesthetic medicine based out of the centre of London, UK. And over 3,000 medical professionals have gone through our academic programs to achieve a postgraduate diploma in aesthetics. They will get a title after their name, PG Dip Aesthetics. If you want to learn more about our programs, how you can gain your qualification and learn how to inject in a really structured, systematic and evidence-based way, then click on the details below and our team will be happy to have a conversation with you. Right, that's enough from me. Let's get back to the video. But if you are enjoying this and you want to see more content like this, please subscribe and click like.
Okay, Zoe, so the first place we're going to start is in the fold on the right-hand side. Sharp scratch 3, 2, and 1. So here I'm using a 22 gauge 38 millimeter cannula. This is a relatively high risk area from a vascular perspective because we've got the facial artery that runs normally just lateral to here in layer 2, which is the layer that we're treating. However, by using a blunt instrument, and we know that the lower the gauge, the safer the instrument. So a little bit of pressure up here. We can see I'm quite clearly in layer 2 there, and I can see the outline of my cannula. If you're in layer 2, you will feel these little adhesions as you come up, and as you come a bit more superior, it can be a bit uncomfortable as well. I'm using my non-dominant hand to help provide some traction. Staying in layer 2, and I'm doing a little bit of fanning up here, always staying medial and in the fold. I don't want to be adding any volume to the lateral, to the nasolabial fat pad. The product I'm using here is Rejuvenation Ultra, which is a medium G prime product. It's suitable for use in layer 2, but still gives us really nice projection. While I'm fanning here, part of the process is also doing a little bit of subcision too, and that helps with some of the dermal creasing that you can often find in this area.
That looks really good, Max, and you can see how much that's reduced the shadow, especially moving towards the base of the nose as well.
Just going to ask you, can you sit forwards for us, Zoe? And then just look up into the camera here, and we can see left compared to right. There's a little bit of redness there at the moment, but it has softened, particularly up in the corner of the nose, even though we haven't directly treated that deep pyriform fossa. Okay, so the next one I'm going to treat, Zoe, is the upper lip lines. So here I'm coming along to address some of these little perioral lines, and I'm going to try and use the same entry point that I used for the nasolabial fold. Again, I'm staying very much in layer 2. There are 2 parts to this treatment. One is adding small little micro droplets of filler. The other is actually subcising and creating that space between the muscle, orbicularis oris, and the dermis. Because it is quite a sensitive area, what I'm doing is, as I'm going, I'm injecting really small amounts of product that has the double effect of opening that space up a bit, as well as adding small amounts of local anesthetic to make the procedure a bit more comfortable. So I'm just doing some antegrade little micro droplets or micro aliquots until they reach the midline. I'm giving that a bit of time. I'm coming a bit more inferiorly now. The whole time I can always see quite clearly the outline of my cannula. I don't want to be going too deep here. I don't want to end up in the muscle or underneath the muscle. It's really common. I warned Zoe beforehand that this area can bruise a little bit. And the reason is that you have small perforated vessels that go from through the muscle and into the skin. And when we're doing this subcision, it's normal to disrupt that slightly.
So Max, obviously we're using fillers here, but any other possible treatments that you'd recommend for perioral lines if we're not thinking about fillers?
Yeah, so really the more you use around here, the better. And if you can, like we said, the causes are multifactorial, so the treatments should be as well. So that can be, if we're going from deep to superficial, relaxing the muscle a bit. With this, you've got to be careful. It's a functional muscle. If we over-relax it, it's going to end up looking strange and feeling really quite uncomfortable for our patient. The next thing would be doing what we're doing here. You could use something like a polynucleotide or something that's gently biostimulatory in layer 2 here. Or you could treat the skin itself, and that's either with something that's going to, like hyaluronic acid, that's going to draw water towards the area, or something that's going to stimulate collagen in the deeper layers of the skin. Even something like microneedling, CO2 lasers, anything resurfacing will certainly help. Now, if you pout for us like this, Louis, great, and just tilt your head forward slightly. There we go, great. And you sit right up. So there we go. And then unpout. There we go. And then pout again. So we can see actually that on this side, we've got more of those creases coming down. And on this side, it's not doing it quite as strongly. And part of that is because of the gap between the muscle and the skin now. And then you can relax. This is one of those areas that we always undertreat, because if we add too much too quickly and it draws water towards it, it can end up looking a bit more swollen. Okay, so next we're going to be treating the lower face and providing some traction on the skin here. Sharp scratch in 3, 2, and 1. I'm potentially making my life a little bit harder because I want to use a single entry point for both the pre-jowl sulcus, this area in front of the in the labiomandibular fold, and the labiomental crease as well. So here we are in layer 2. Don't want to be any deeper than that. I'm bringing my cannula down into the pre-jowl sulcus here, just on the mandibular border here. And I'm fanning some product, making sure that I'm not going posteriorly into the jowl fat. We've got the DAO muscle here, and we can feel when we're in layer 2 that it's quite tight to get over that. So again, there will be a little bit of subcision that can potentially lead to some bruising as well. That's completely normal. There we go. I'm using Revness outline here. The reason being is that it's a high G' product. It's really quite firm, gives us good support, but at the same time, it's very cohesive. So in this mobile area, it's less likely to move around. Last little bit down here. I'm finding that I'm having to come back to my entry point to change my angle slightly. Otherwise, I get caught within the muscle. There we go. And now I've done some subcision. It's much easier to treat this area. Now I'm coming back to my entry point, staying in layer 2, and moving anteriorly now. Again, this is not the most comfortable area, so I'm adding small amounts of product to help open that space up. Doing brilliantly, Zoe. Open that space up and get some anesthetic in as well. Meanwhile, gently subsiding, coming towards the labiomandibular crease here. You definitely don't need to do this all from a single entry point. Staying in there too here. Just feel like we're a little bit deep there, so I'm coming back to my entry point.
So depth control is actually quite challenging sometimes,
Yeah.
because if you're really close to the skin, you'll see the grey of the needle, and sometimes you can create a little line of filler just almost within the dermis, or you can be too deep and it doesn't have too much of an effect. So it's just getting that intermediate depth for the labiomental crease.
And it's there's lots of lip depressors here and chin elevators, either mentalis, and all of them want to seemingly pull your cannula a little bit deeper. So I'm having to always make sure I'm staying nice and superficial, but equally not too superficial. And someone like Zoe who's got good skin quality, in this area, you'd almost rather be a little bit more on the superficial side than you would too deep. But still, best to be in exactly the right spot. Coming up to the midline of the labiomental crease here as well. Great, so I can feel now a bolster of filler down here that's adding support between, if you sit forwards for us, Zoe. Okay. And then look up into that camera there, great. So I've added this filler down here, and we can see already that if we go from the jawline, following the mandible along, we've got less of that depression in the pre-jowl sulcus. I'm going to do a little bit more massage on this side to try and sculpt it along with the jawline, but we can already see with just placing the product there and doing a bit of subcision that it's softened out fairly significantly already. Okay, we're going to treat the lips next. Now for the lips, I'm going to be using Reveness Ultra. So part your lips very slightly. That's wonderful. And I'm going to be using a microbolus technique. So we know that the lips are divided into compartments. We've got 6 anterior compartments in the upper lip in front of the muscle and 6 anterior compartments in the lower lip on top of the muscle. If you pout for us, we probably see it better on this left-hand side now that we've treated some of these perioral lines up here. But where the perioral lines go into the lip is normally where you get where the division between the compartments is. And relax again. Very good. And then part your lips very slightly. So we want to target those compartments and add some volume back into them. And the technique that I'm going to do, which is using microboluses in those compartments, is something that we call a compartment respecting technique. Okay, you can feel a sharp scratch here now. The idea being that we're not creating perforations within those compartments, and that means that filler is less likely to move from one to the other and therefore less likely to displace. So that's the medial compartment. We're now going to treat the middle compartment. Well done. And here I'm very much in layer 2 in that subcutaneous layer. And one more little one laterally to target that lateral compartment. I'm not putting as much volume here as I did in the other compartments. So just 0.025 there. And even without any massage there, we can see that the right side of the lip already looks a little bit more lifted, and I can see from the side that it's more volumized. I'm now going to do the same in the lower lip. I'm going to start laterally this time. Sharp scratch. I'm doing that 0.025. And again. There are a huge number of lip techniques out there, but really we're following basic principles. And with that, we want to cause as minimal trauma as possible. That's going to reduce both the discomfort of the patient, as well as bruising, swelling, and that in itself will reduce the risk of complication, both vascular adverse events, as well as things like infection, and displacement, both acute and chronic, off the filler. Just tilt your chin up very slightly. And again. And again. And one more little one at the top up here. Tristan, what's your preferred technique in the lips?
Yeah, so I was just about to comment on this, Max. So I think that you're showing this bolus technique really nicely, and I think the one caveat with that is that you do have to be able to control the depth with your needle tip, and so you're comfortably letting the filler flow into those compartments, but you're also aware that the vessels are going to be in the deeper plane to where you're injecting. And I think when you're starting out, this kind of technique might just feel a little like you don't quite have the control to achieve this kind of results you are, in which case more linear threads may be the way to start. But I think once you've got a good understanding of depth, for me, it's a fantastic result what you've achieved there with the lips, and incredibly natural. And you haven't had to create lots of linear tracks in the lips that often can lead to lumps and nodules and a lot more trauma and bruising as well.
I think what is nice about this method, though, is if you are starting out, is that you've only got one thing to control at any one time. It's either if you're doing a retrograde linear thread, you'll have the depth control. You're then doing a retrograde thread whilst injecting at the same time. With here, if you're really confident with your depth, once you're at the right depth, you can then, as long as you can stay there, you can then do your bolus. But the hard thing is getting that depth in the first place. Too deep, too superficial, it can completely change your result. And you've got to be consistent in both the upper and lower lip and left and right too. So I can feel just by pressing on the lips that you would expect this to feel lumpy. I've just done little boluses in the lips, but actually, because we're within those compartments and we're injecting slowly, that product really does flow nicely within the compartments, and it neither looks nor feels lumpy in the slightest. So if you wouldn't mind sitting up for us.
What we learnt in aesthetic medicine even 1 or 2 years ago is now outdated. Why? Because aesthetics is still a relatively new science, and the research underpinning our work, particularly our understanding of anatomy, has advanced significantly. Hello, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I want to introduce you to GEM, the Global Evidence Matrix. GEM is a dynamic, evidence-based framework that gives injectors a clear, consistent guide for safe, effective treatments, all grounded in science, not in corporate sales pitches. GEM combines clinical research, anatomical knowledge, and injector expertise, and it's always updated with the latest evidence. Think of GEM as your interactive map for facial aesthetics, guiding you through every step from technique to product choice. With GEM, you're not just injecting, you're working at the forefront of medical aesthetics. Join us in setting a new standard for safety and results.
And then look up into the camera. And then if you smile with all your teeth, and show your teeth, great. We can see that the lips are staying where they are, and then big pout. Very good. And we can see really nice volume there. And relax again. I'm just going to turn you that way and that away. So what we've done is we have treated the nasolabial folds here. That's softened out really nice. Just tilt your head up very slightly. Brilliant. And that's polished off what we've done in the pyriform fossa, the last treatment, as well as the biostimulatory treatment back here. In the lower face here, we've blended the chin with the rest of the mandible, softened the labiomental crease, add a little bit of volume in the lips, as well as soften those perioral lines. And back this way. That again. Can you see a difference now?
Yeah.
You can see a difference now. Okay, we got there. Third time's a charm. So yeah, is it swelling wise? Lips kind of where they are at the moment. You might find tomorrow morning they're a bit more swollen, a little bit bruised. Then it will taper down and will be virtually where you are at the moment.
Great.
You see this slight ledge up here? Yeah. That will soften.
Okay.
If you pout, with this, you see those lines of nearly gone.
How long will this feel numb for?
About half an hour.
Okay.
Yeah, just be careful with hot drinks until then.
Okay.
And then the lower face, this area here, I think has softened nicely.
Yeah.
Very nicely.
Definitely. Yeah.
That plus this is going to keep getting better. It's going to hold really, really well.
Good, thank you.